navale ku'umaka kaumailu nae I kaulu vehi vehi o pu'uma ili ili e Pi'i akula I ke kukuna o kala I nā kuahivi o Wai'ana At the Wai'anae Coast Comprehensive Health Center, a physical transformation of our main campus into a state-of-the-art health care facility is well underway to meet the needs of a community whose population has tripled in the last 40 years. Guided by a three-phase construction plan developed nearly 10 years ago by our community-led Board of Directors. Phase 1 was completed in 2009 with the Harry and Jeanette Weinberg Family Medical Building. In early 2012, staff said aloha to the 40-year-old original clinic building before the wrecking ball demolished it to make way for Phase 2, the Harry and Jeanette Weinberg Adult Medical and Pharmacy Building. Once it is completed in 2013, this building will serve as a temporary location for the emergency department during construction of the final phase, a two-story, 24-hour emergency medical services building that will meet the needs of future generations. We have come a long way since our humble beginnings in 1972, when just one doctor and a staff of 5 began delivering services from a temporary location in a building across from the Wai'anae McDonald's. This small clinic provided much-needed relief to a community that had limited access to health care since the closing of the Wai'anae Sugar Mill Dispensary in 1957. With the closing of the Wai'anae Sugar Mill, the community lost not only a major employer, but also its access to health care. Residents were forced to make a 1.5-hour journey to Honolulu to see a doctor. Only the very ill sought care. In 1966, concerned residents formed a health task force and, in 1969, established the Wai'anae Coast Comprehensive Health and Hospital Board Incorporated as the policy-making body of the Wai'anae Coast Comprehensive Health Center.
I think it's the connection to the community that's really made a big difference. We are the community, and that makes a very different scope of how we approach what we're doing and our growth. And the changes that we've made have all been to improve what we can deliver and help with the community.
In 1972, construction began on the first phase of the health center on land acquired from the Hawaiian Homelands and the Department of Land and Natural Resources. The land sits at the base of Pu'umailiili, a sacred mountain to native Hawaiians that holds significant mana, spiritual energy. The mountain represents ku energy, and the flat land at its base where the health center was built represents hina energy. In the Hawaiian culture, wherever these two energies meet, powerful healing energy is created. In August 1973, the building opened with 33 employees and 2 physicians delivering services from 9 to 5 Monday through Friday.
They wanted to open, to the community to deliver services by October 1972. So it was a 2-year planning project funded by the federal government, and I remember thinking there is no way that we're going to be able to accomplish all of this in just 2 years.
The first 10 years firmly established the health center as it continued to add to its services. In 1974, weekend emergency room services began, supported by a State Department of Health subsidy.
I think we've made an enormous difference. I do live in the community, and I've lived in the community since about late 70s or 1980. And definitely, I think we have helped the community not only in emergency care, but in just living well, and improving the general health.
In 1992, the Health Center celebrated 20 years of providing comprehensive health care to the Waianae Coast community.
It really is beautiful to be here at what I feel is the example facility in this state of how we can bring together community health services and prevention and public health and healthcare into one place, under one roof, and really serve the needs of a community. It's a very, very beautiful idea, and here it's not hypothetical, it's for real. I guess it's kind of amazing that this is 20 years of this wonderful idea. Of course, the federal government helped us begin it, but now we in the state of Hawaii and the people of Hawaii and I have to make sure that we continue it and spread the idea to other communities, frankly, where the same kind of idea, the same kind of coordinated care is needed around our state.
And I hope that we will all gather together 20 years from now and carry on this blessing of healing.
The past 2 decades have been filled with milestones, including the construction and opening of the Native Hawaiian Traditional Healing Center, governed by a kupuna council of respected Native Hawaiians skilled in the traditional healing arts. The main campus continued to expand to accommodate its growing services. The campus was designed not just for function, but with an eye for beauty and an appreciation of nature and the arts and culture. The path to wellness, walking trails encourage patients and staff to connect with the natural beauty surrounding them and take a moment for quiet reflection in their busy lives. The Health Center also continued as a pioneer of technology and in 2002 was the first health center provider in Hawaii to implement electronic medical records. On-site laboratory, dental, X-ray, and mammography were established to meet the community's growing healthcare needs. The expansion continued beyond the main campus as satellite clinics opened to make healthcare convenient. The Health Center filled a growing need for adult daycare services and established its program in 1987. Today, the adult daycare program manages 5 sites on Oahu. The Health Center long ago recognized that addressing the needs of the community needed to go well beyond just providing medical care. As a healthcare home, the Health Center believes that job training and job development are also crucial to the health of a community. With the Waianae Health Academy certificate programs and our own medical school in partnership with A.T. Still University School of Osteopathic Medicine, we are addressing critical provider shortages and training people for good jobs, growing our own healthcare workers and physicians. The Health Center has been recognized for its efforts with awards acknowledging its leadership, programs, and even its beautiful grounds. Our leaders have also been recognized with such honors as longtime board member Kawila Clark, being named in 2011 to the influential position of chairman of the National Association of Community Health Centers, the first Native Hawaiian to hold this position. As we celebrate 40 years, our community board continues to guide us as we seek the opportunities and face the challenges ahead.
We'll also turn around the pico, the center of the entire community is our Native Hawaiian Healing Center, because that's what makes us different. What makes us different is that we have the kupunas guiding us to take care of the community in a Hawaiian way.
Today, the dream envisioned 40 years ago lives on through through the health center's dedicated community board members and nearly 600 employees, serving 30,000 patients during more than 170,000 visits at our main campus and 4 satellite clinics. Our list of services continues to grow as we work to address the needs of our community. Healing, learning, innovation. At the Waianae Coast Comprehensive Health Center, we continue to make dreams a reality.